How do we diagnose food sensitivities? That's one of the most common questions that we get asked at our clinic. Welcome back. I'm Dr. Maria Azizian, a board certified general surgeon and IFM certified functional medicine provider. So today we will be discussing a blood test for food sensitivities. Previously, we talked about food tracking and elimination diet as ways to find out about your sensitivities. And in some cases, that may be enough. A good example will be if you have a clear correlation between a certain food and a specific symptom, meaning that you eat a certain food and several hours later you develop a rash or migraine or nasal drip. Unfortunately, specific food to specific symptom correlations are not always clear as they may be inconsistent, too delayed, or complex, overlapping with other food sensitivities. I would like to note that food sensitivities are different from food allergies. Food allergies are quick and often dramatic. In some cases, they lead to life-threatening reactions. Food sensitivities, on the other hand, are more subdued. They may take anywhere from 2 to 72 hours to manifest after eating the trigger food. If they are eaten habitually, they can cause chronic conditions. There are so many food sensitivity tests on the market right now. At our clinic, we use a food sensitivity test by the company called KBMO Diagnostics. A few words about the company and the technique they use. And I promise I will not bore you with too much immunology. The goal of this video is to show a practical side of food testing and show how the test works, what the report looks like, and how to interpret it. We will go over a sample report, including the specific foods that are tested, the way KBMO grades the food sensitivities, and also the bonus gut component of this test. KBMO was founded by Dr. Brent Dorval, who was one of the pioneers of HIV testing in the 80s. The company has several products, with their main test being the food sensitivity testing that they call FIT 176. Their testing is based on measuring two immune system parameters, IgG immunoglobulin and immune complexes. So what is IgG? IgG immunoglobulin is a protein that is a type of antibody. It is made by the immune system to help protect our body against pathogens. So what are pathogens? Pathogens are anything that our body considers to be hostile for the body. So bacteria are pathogens, toxins are pathogens. However, for some reason, in some cases, certain foods could be perceived as pathogens by our body. And then these foods become the bad guys that activate the immune reactions, such as eczema, for example. Another component of this immune response is participation or formation of these special groups that are also made of proteins. These protein groups are called complement groups. There is a complement group called 3D or C3D that helps our immune system clear away harmful substances. Of course, I'm being a little simplistic here. So C3D and IgG act together. The role of C3D is to tag and identify these harmful pathogens. It is almost like putting a sticker on these pathogens so that the immune system can tell them apart from non-pathogens. Basically, it's a marking system to separate the good guys from the bad guys. Unfortunately, for some reason, some foods are seen as bad guys and are being tagged. Once something is tagged, it communicates to the immune system that they need to attack these bad guys. So the special soldiers of the immune system, called the natural killer cells, and I think the name says it all, are released along with phagocytes and some other cells. These cells execute the attack and create inflammation. Currently, there's a strong hypothesis in the medical community that most diseases are based on inflammation. For example, obesity is one of inflammation-related diseases. Many types of cancer are also now seen as having inflammation as one of their mechanisms. As you see, there's a fertile soil for more research on this topic. So back to KBMO. They don't only look at IgG antibodies, because if you only assess IgG antibodies, you may have some false positives and false negatives. They look at the complexes of IgG and C3D complement proteins, as we discussed earlier. Measuring these markers together leads to a more accurate response. So what happens on a practical level is that your blood is being tested against multiple foods, and your IgG and C3d complexes are being measured. The more of these immune complexes are produced in response to a specific food, the more sensitized you are to this specific food. KBMO offers a comprehensive test that includes 176 foods. Enough with immunology now. We now move on to the practical part of testing. The test is a blood spot test, meaning that you don't need a blood draw at the lab. The kit includes a lancet to poke a finger. You can do it yourself at home, or if it's an elderly patient, we are happy to help them at our clinic. Once the finger is poked, a tiny droplet of blood is smeared on little circles on a small card. You put the card in a pre-stamped envelope that you can drop at any mailbox. Then you wait for the results. Let's look at how KBMO reports come out. We're featuring here the FIT 176 test that includes the assessment of 176 foods. Let's go over the food groups. As you see, there are dairy, eggs. By the way, there is a separation between egg white and egg yolks. They're treated as two separate sensitivities. In fact, just a little tidbit of information. Egg whites are more allergenic and more sensitivity inducing than egg yolks, which a lot of people don't know. So next we have fish, including other seafood such as shrimp, that is a cause of many food sensitivities. Then we have grains, beans, vegetables, fruits, nuts and seeds, spices, and some other foods. There are a total of 176 foods, as I mentioned, and I would also like to bring your attention that food dyes, natural sweeteners such as stevia and monk fruit, MSG, and other components of foods are included in this comprehensive test. Now we will look at the sample result report. There are different levels of sensitivities that are color-coded accordingly. The most severe food sensitivity is in red, and it is graded as 4+. Then slightly less severe reaction is at 3+, and it is color-coded orange. Then we go to yellow, 2+. You see these three reactions on the first page of the report. These are foods to avoid, as they're likely the culprit of all or at least some of your symptoms and of general body inflammation. So in the sample report, we see that our fake patient has 4+ reaction to gliadin in wheat, gluten in wheat, and to the whole wheat. Based on that, it is safe to say that this patient is sensitive to the whole wheat and its components, including gluten. Additionally, this patient has 4+ reaction to pineapple. Next, we have 3+ reaction to egg yolk and salmon. The next row shows 2+ reaction to egg whites, bananas, baker's yeast, and brewer's yeast. We can also view this report in a long form with all foods listed and color-coded. In addition to red, orange, and yellow reactions, there are now light green and green colors, as you can see. Light green signifies a very mild reaction, and green is a safe food for you. In addition to this report, patient also gets an app that has this report and a sample menu for a week. Those apps are very useful, especially if you have many sensitivities, as it helps you at the restaurants to avoid foods that you're sensitive to. At our clinic, we go over the diet and personalize it further for the patient by taking into account their personal preferences and incorporating their other health issues. The second and crucial component of this test is testing for a leaky gut, presence of fungus such as Candida and pathogenic bacteria. It is called gut barrier panel. We have discussed leaky gut and gut dysbiosis on this channel, so I just want to do a quick review in correlation with this test. The main marker of a leaky gut is zonulin. Zonulin represents increased gut permeability, meaning that the tight connections between our gut cells are compromised. When that happens, in addition to zonulin, another marker called occludin is secreted. Occludin is also measured in this test. It is very convenient to have both markers measured through a simple blood spot test. As part of this gut barrier test, there's also an assessment for fungus named Candida. I can't say how many times in our clinic I hear patients worry whether they have Candida. And the last thing that you see on this panel is LPS. That stands for lipopolysaccharides. LPS is a component of a gram-negative bacteria, and it is associated with leaky gut, higher potential for infection, and chronic inflammation. As you see, this is a very helpful report as it opens the door for implementing changes in the patient's diet, and it guides us, the practitioners, towards correct supplements and lifestyle recommendations for the patient. Lastly, I want to address a question that is often asked at our clinic. Are food sensitivities the cause of a leaky gut, or is leaky gut causing food sensitivity? And that's, of course, a very good question because there's no straightforward answer to it. In some cases, yes, food sensitivities could lead to a leaky gut. And in some other cases, it is the actually opposite. The leaky gut and gut dysbiosis may trigger and cause food sensitivities. Similar question is whether food sensitivities could go away with time. Definitely, food sensitivities may resolve as changes in your lifestyle and diet occur. Healing leaky gut often leads to healing many other aspects of our health, including food sensitivities. Thank you so much for watching. Bye-bye.